Did you know that if you have diabetes, your risk of heart disease can be 2 to 4 times higher than someone without it? That's a huge difference. And it's why understanding the connection between diabetes and your heart is so important. Most people think diabetes is just about blood sugar, but it's much more than that. It quietly damages your blood vessels, increases inflammation, and can set the stage for serious problems like heart attack, stroke, and heart failure. In this video, we're going to break down exactly how diabetes affects your heart, the warning signs you should never ignore, and the steps you can take to protect yourself. And at the end, I'll also share how you can connect with a trusted healthcare team through myprontohealth.com to stay ahead of these risks. To understand how diabetes affects the heart, let's start with what happens in your body when blood sugar stays high. When you eat, your body breaks down food into sugar or glucose. Insulin, a hormone made by your pancreas, helps move that sugar from your blood into your cells, where it's used for energy. But with diabetes, either your body doesn't make enough insulin, or it can't use it properly. As a result, glucose builds up in the blood. Over time, those high sugar levels damage the lining of your blood vessels and cause them to become stiff and narrow. Think of your blood vessels like water pipes. When the lining gets rough and sticky, cholesterol and fats are more likely to cling to the walls. This buildup is called atherosclerosis, and it's one of the main reasons why people with diabetes are more likely to develop heart problems. Now, let's talk about the major heart conditions linked to diabetes. Coronary artery disease, CAD. Narrowed arteries reduce blood flow to your heart. This can cause chest pain, also known as angina, and in severe cases, it can lead to a heart attack. Heart failure. Over time, the heart muscle can become weak and stiff, struggling to pump blood effectively. Heart failure doesn't mean your heart stops working. It means it can't keep up with the body's demands. 3. Stroke. The same process that narrows arteries in the heart also affects blood vessels in the brain. If blood flow is blocked, it can lead to a stroke. Peripheral artery disease, PAD. Diabetes doesn't just affect the heart and brain. It can also damage circulation in your legs and feet, making it harder for wounds to heal and increasing the risk of infections. What's especially concerning is that these conditions often develop silently. By the time symptoms show up, the damage may already be advanced. Diabetes is often called a silent partner to other health risks. High blood pressure, high cholesterol, obesity, and smoking are all common among people with diabetes. And when you put them together, the risk multiplies. For example, someone with diabetes and high blood pressure is twice as likely to develop heart disease compared to someone with diabetes alone. Add smoking to the mix, and the chances increase even more. This is why doctors emphasize not just controlling blood sugar, but also managing the full picture: blood pressure, cholesterol, weight, and lifestyle habits. So, what should you watch out for? Some common warning signs of heart problems include chest pain or tightness, shortness of breath, even with mild activity, fatigue or weakness, irregular heartbeat, swelling in your legs, ankles, or feet. But here's the tricky part. Many people with diabetes have nerve damage that can dull pain. This means a heart attack might not cause the classic crushing chest pain you've heard about. Instead, you might just feel unusually tired, dizzy, or short of breath. That's why it's so important not to ignore even subtle changes in how your body feels. The good news is that while the risks are real, there's a lot you can do to protect yourself. Here are some proven steps. Control your blood sugar. Keep your A1C, fasting blood sugar, and daily glucose levels within your doctor's recommended range. Watch your blood pressure and cholesterol. These are just as important as your sugar numbers. Eat for your heart. Focus on whole foods, vegetables, fruits, whole grains, lean proteins, and healthy fats like olive oil and nuts. Avoid processed foods and too much added sugar. Stay active. Aim for at least 150 minutes of moderate exercise per week, like brisk walking, swimming, or cycling. Quit smoking. Smoking is one of the biggest accelerators of heart damage in people with diabetes. Follow your treatment plan, whether it's insulin, oral medications, or lifestyle changes, consistency is key. Get regular checkups. Routine screenings for cholesterol, blood pressure, and kidney function can help catch problems early. Diabetes and heart disease are deeply connected, but that doesn't mean heart problems are inevitable. With the right lifestyle choices, medical care, and ongoing monitoring, you can significantly lower your risks. Remember, your health isn't just about numbers on a lab report. It's about energy, quality of life, and the freedom to live the way you want. If you're ready to take the next step in protecting your health, visit myprontohealth.com. You'll find trusted care, helpful resources, and the support you need to stay on top of your heart and diabetes management.